guys, thank you for visiting our page. This is our page on scrotal tightening and scrotal lift. It's interesting that since publication of the Forbes article on ironing, the number of people who are interested in the condition has increased at least twofold. But I've been performing the surgery for the last 15-20 years. So just to give you overall view, this is different from transgender surgery. And there's a lot of confusion about who's having it done. Here's my 5 cents on that. This is actually not a very well-known procedure, but it's not new. The goal is to remove extra skin from the scrotal area. Now, when I try to do it as most people do and you just remove the skin, it doesn't work because the skin really doesn't hold anything. The problem is stretching and loosening of the muscle. So what needs to be done, the muscle needs to be tightened, and then this extra skin can be removed. When we perform this procedure, some patients have a solid muscle, some don't have the muscle. And sometimes what happens, which I've seen several times, is that the testicle actually herniates or goes in between the muscle fibers, causing the pinching. So when somebody does sit-ups or somebody does any kind of sports activity and they're complaining that they have like uncomfortable feeling in a testicle, what I've seen in these cases is, again, the testicle goes in between the muscle fibers. So usually what I have to do, I have to create two-directional hammock, basically a hammock from the front to the back and from side to the side. And then the skin falls together, and the skin really doesn't carry any weight. All it does, it kind of creates the coverage. And it's very important to prevent the future stretching. The condition is actually more common than you might think. The patients who had varicocele, which is the increased veins in the testicles, or hydrocele, when you have fluid around the testicle, and as a result the testicle gets stretched out, eventually they can develop the stretching and discomfortable feeling, and they want to have the scrotum reduced. It's not just for cosmetic reasons. And I've seen law enforcement people who would come in to have it done because this extra skin in the scrotum get caught into the belts that go around the thigh. Athletes, especially who are on bicycles, where they have the skin folding and catching it between the leg and the seat of the bicycle. One of the most common complaints that I get from the guys over 40 or 50 is that when they sit down in the toilet and to do number two, everything relaxes and the testicular sac starts touching the water, which is kind of gross. So that will be one of the most common things. And then usually when there's a large discrepancy between the ages of the partners in a couple, that's when there's also an issue. So that's the way it's done. The incisions could be different. I've tried a lot of different things. One of them is vertical, straight from the base of the penis along the scrotum all the way back, and that's the least noticeable one because whenever it heals, it actually looks like a natural line in the middle. I've tried doing Z-plasties, and some people on the internet that market Z-plasty, I don't like them. They look okay when the penis is hanging down and you can see the sac behind, but when the penis is actually erect, it kind of looks a little strange. And if it doesn't bother you, it can be done, but I don't see that much difference. And I've developed a technique to improve the penis scrotal webbing by doing a strip of the muscle rather than doing a Z-plasty. And then in Europe, people propose doing it with incision going across the sac. So if you pick up the penis straight up, and then there is a sac underneath, they go right across. And it may be okay, but I just don't like the look of it because it's in opposite direction of where it's supposed to be. It's not terribly noticeable, but depending how critical you are of the appearance, that may determine the decision. So we can do any of these techniques, but I like my technique where I go vertically straight down, and then I do internal tightening of the muscle with a strip of the muscle to improve penis scrotal webbing, and then sew it up so on the outside it doesn't look like anything had been done. One more thing to mention is when you look at the appearance of the genital area on the male, you're not really looking only at the sac. You're looking at the appearance of the circumcision, you're looking at the pubic area, at the extra fat, at the extra skin. So when we look at the patients desiring improvement of the scrotum, we also discuss the options to improve the overall appearance. So if that bothers you, also we're happy to discuss it. And if all you want to do is tighten the scrotum, it's very possible. Again, the procedure is not terribly complicated. It is done over about 1 hour in a hospital or in the office operating room setting. sedation or general anesthesia, depending on your choice. And then the suture is usually self-absorbing. We do have patients traveling from a distance to have it done, and we ask you to stay in the area for at least a week just to make sure that major complications that could happen, infection, bleeding, scarring, so forth, are addressed, because the sutures stay for about 2 to 3 weeks and they fall apart on their own. One thing to mention is it's very important to keep the area elevated, and by the nature of things it's really difficult to have it elevated because it's located on the bottom. So we do recommend using jock straps and some roll towels that we will tell you about to help out with reduction of swelling. Usually the complications are minimal. The only thing to consider is that if you are of the age when you still may consider having children, this surgery hypothetically can change the temperature in the sac and change the viability of the sperm. There's no studies to support or deny it, and it's just hypothetical scenario. Just have it in the back of your mind if you are still thinking about having kids in the future. Otherwise, it's a great surgery with high level of satisfaction. If we can be of assistance, just click below, make an appointment, and we're happy to see you here. Bye-bye.